All right. Good evening, everyone. I'm going to call to order this meeting of the Dunn County Health and Human Services Board for Thursday, August 21st. We are a week earlier than our normal schedule because we have to have a budget, public hearing on the DHS budget. So welcome, everybody. Let the record show that all of the members of the committee, save Supervisor Breslin, are present. All right, and now I'm going to shift gears a little bit and call to order the public hearing on the Dunn County Human Services budget. I assume, Paula, that this was effectively noticed. All right, do you have the date?
Yes, it was correct. Yeah, it was for the last 2 weeks.
Okay,
noticed.
in the Colfax Messenger?
Yes.
Okay, all right, great. So if you want to start with an overview of the budget, Paula, and we'll go from there.
Thank you. So the Human Services 2026 proposed budget is in front of you, both in your packet, and I pulled it up on the screen. When we looked at the comparison of 2025 to 2026, you'll see that we are currently at an overage or a request of an additional 352,329, and I don't know how my computer's been doing so many goofy things in the last few days, so I'm not sure why it says I'm still sharing, but I'm not. Let's stop this. Sorry, I got the scroll of death now. Well, I'm gonna just share with you that right now we are asking for an additional $352,329 compared to the tax levy that we asked for in 2025. And the reason for this is not real simple. There's so many changes that happen within a budget year. We've had several grants that have been discontinued. In an example, the first episode psychosis grant is ending this year, which was a major funding source for that program. So the expenses also will be subtracted in the budget, right? And those staff will move over to a program called CCS as a provider and billed through Medicaid, and we will not be serving individuals that do not have Medicaid. So that grant funds would not be there to support that. So you'll see that as a significant change in our budget. There was changes with the funding for a family and children's service unit program that is no longer available to us. And so we took that funding out of the budget. What we did is move some things around. So we basically subtracted 2 full-time positions from our budget with salaries attached to that to help with some of those funding issues. So it's not apples to apples as far as salaries and wages because we did remove 2 to help with some of this not having the revenue to match with that. So there was that piece of it in there. So of course, there's a little salary and fringe increases. Can you show it? Dan, are you able to do that? Yay. When you make it bigger? Because I can't even scroll on my computer. It won't let me do anything. Totally locked up.
Everybody got their glasses on?
And I didn't print any of these out because I thought there are lots of documents, so.
Forgive my grammar, by the way.
And this is like very frustrating.
Here you go. Do
Okay.
you want to just highlight why there are some numbers in yellow?
That's the proposed budget.
Okay.
So that's my, if I can just. In highlighted yellow.
Mhm.
On the difference, and then you're seeing the changes to the proposed budget.
Question. Oh, perfect.
I'm sorry. Thank you very much. So what we're asking for in tax levy that we received in 2025 would be the oh, can't even read this now. Where are we? In 2025, we asked for 5.2 million in tax levy. What we're asking for this year in that is 4.897. And then, so why is this at 564
This is a bit different than it's
Yeah, me
different than the
too.
one I have. It's obviously, it's been revised,
Okay.
which is part of,
I'm
the
like
budget
looking at what's
process.
going on. This is not.
it
what we
changes
had.
every day. And we can't help that. Do you wanna?
Yeah, so,
As,
so apparently this is the new one as of today. So it looks like we're asking for an additional $564,944 needed to help support the programs that currently are in the budget. It's the same staff except for we reduced by 2. And the program that we reduced was the vet program and that was the major program. The other one, we moved dollars around from salary into that supportive, targeted supportive handling money to help support families and family and children. And so we cut a position to help move those staff dollars in there. So with that, with the added cost of looking at placements, what we do is look at a 3-year.
the microphone.
What we do is look at a 3-year history with all of that and then come up with the numbers needed for this budget with the cost of placements, salary increases and such. So 564.
All right, and for those who have the packet that was publicly noticed, there are some differences. Let me just read those numbers. In the document that we all received, the total revenue is $16,102,046. The total expenses are $16,454,376 for a shortfall levy ask of 352,330. These numbers obviously are different. 16,142,316 with expenses coming in at $16,707,259. And likely it will change again.
I know one of the things, and I don't know if this is what Beata did to make these changes in here. But when we had our original numbers, there was no fringe and salary increases in there. So that adjustment might have been made. I don't know. Dan, if you know why it changed, I'm like,
He does.
I'm feeling like really shocked. Yeah, I think that's what Diane just read, but maybe.
Yeah, that was what was in our packet, Greg.
Yeah, the numbers that are shared up on the screen reflect new information. And so they do reflect changes to our health premiums for employees. This demonstrates all of that cost being absorbed by the county. So obviously that'll be something that will be going to the county board to be talking about some
Yep.
of those different options. But yes, now that I think of the fact that this was noticed well in advance, we did not have that information then. We
But now
received that.
but now we
Yep.
do.
Yep.
And if we have citizens watching this video understand that this is the county budget process is always in flux. So there are smaller changes, and probably likely more, so. Do we have any public, first of all, Paula, do you have anything else to add?
No,
Okay, do we have any public comment?
no.
No emails, no? All right. All right, then thank you very much, and I'm going to adjourn the public hearing. Next item up is the minutes from our July 24th, 2025 meeting. They were in your packet.
I so move.
Supervisor Steen moves. Is there a second? Dr. Hall seconds. Any additions or corrections? Additions or corrections? If not, all in favor signify by saying aye. Aye. Any opposed? The minutes for July 24 are approved. We don't have any general public comment, I take it, either? I'm sorry.
I'm a member.
I'm sorry, but you want to say something? Well, you're welcome to.
I'm with WPR in Wisconsin watching. I got a little lost, but I'm glad I'm here.
Well, I'm glad you're found and welcome. Thank you, KT, for pointing out that. I hadn't seen her come in. Okay, all right. Next meeting is, I can't believe it, September 25th. Maybe it'll be cooler by then. All right, the next item up is mobile home inspection cost estimate. This was in your packet. It was cute. It was blue. And am I turning it over to Jeff or to KT or Amy or?
So likely Jeff and I will tag team this. Jeff,
Okay,
what do
all
you
right.
want brought up on the screen?
If you could share the Excel file, that would be great.
She's working on it, Jeff.
That's right. Takes time. Yeah, so there was a request for us to take a look at what it would cost to get the program up and running to do the inspections for manufactured home communities within Dunn County, and then kind of a cost estimate of the sustainability year to year. So I've put together a little Excel document that we can walk through. All right, so it's a little more narrow than what I had on there, but what's in blue is the license expense and revenue and reimbursement that we have to give back to the Department of Safety and Professional Services. That's a 37% reimbursement fee. So what's in blue is what would be our upfront cost, and if we kept the fees at what DSPS charges. So DSPS is Department of Safety and Professional Services. I'll just refer to them as DSPS throughout. The items in orange would be if we doubled the license fee for these units to try to get some more money back from the total cost of running the program. So the first year costs are especially high. So the initial implementation requires large upfront investments. So that's staff training, program development, inspection setup, our health data system that we'd enter the inspections into. It'd likely also be creating an ordinance for this. So that one-time cost that first year are especially high. So if you look at that first year revenue, example one, so our revenue would be $5,700. So that's after we've received our revenue, we've given our just our revenue, and then the expenses include the reimbursement, that license work that I talked about, and our time to do that. So that would put us at about $17,000 for that first year expense. So that first year, we'd be in the hole about $11,000. So each year after that, we'd kind of be trying to dig ourselves out of that hole to begin with. And then after that, the second year, obviously we wouldn't have the upfront costs of creating an ordinance, doing those other things. KTV, if you go up, that second year and after revenue example kind of shows like, okay, here's our revenue, here's our expenses for a normal year of not those upfront costs. So still about $5,000 in the hole with those fees that are there. So KT, you can go down. So what I put together is another example in orange of if we doubled all the fees of what DSPS charges, and then kind of broke it down the same way as I did before. So I won't bore you with all the numbers, but if you keep scrolling down, KT. So that first year revenue would double. So we'd get a lot more back. The expenses would remain the same as that first example, the $17,123. So our first year be about $5,000 in the hole for that first year, and then second year and after we'd get a little revenue, about $676. So that would take a few years with that $5,000 deficit to break even. So that's kind of the breakdown. We'd have to increase fees significantly for that to get our first year expense. If we wanted to break even, our fees would have to go fairly high. Neighboring counties that we looked at are closer to this example 2, what they charge for their fees. Obviously, it would be a double for what they're used to paying for right now. So, you know, after the state reimbursement of 37%, we're still falling below what we'd want to see in the program. We don't want to use as much tax levy as possible. And this would also likely the request would be hiring a limited term employee for 3 to 5 years to kind of get this program up and running.
Oh,
So that would have to be something in the budget we'd have to consider. So looking at the examples I put there, basically the program loses money every year, except for that example 2, where we have higher fees. Year 1 is particularly unsustainable just because of the upfront costs. So fee increases would be the only way to bring the program close to break even and protecting that levy dollar amount. So I just went through a lot of numbers and a lot of information. What questions do you all have?
who has questions for Jeff? We have talked about how complicated this process is. So clearly not going to meet a health department goal of being able to sustain costs, recoup costs.
Yeah, and I think
Dr. Hall.
Oh, go ahead.
I'm sorry, Jeff, Dr. Hall.
Yeah, I was
Yeah.
gonna say one other thing is that some of these parks from DSPS, the list we got, some of them don't have a license, but we don't know why they don't have a license, like their license lapsed. So it'd be some upfront trying to find these people. A lot of the park owners are out of state. So some of that would factor into that as well. Go ahead, Dr. Hall.
Thank you. Thanks, Jeff, for putting this together. And I think this absolutely is in line with what KT shared with us before, that, you know, from a revenue and cost standpoint, certainly it's a challenge to make this work for the county in a way that doesn't, you know, significantly increase fees for the park owners. And I just want to kind of bring back the other issues, right? So cost is of course important. And, we could decide as a county that making sure that people have safe, appropriate places to live is something that we're willing to spend levy dollars on. But as we also discussed previously, if places end up getting closed down because they're in violation, then we worsen the
Exactly.
lack of affordable housing. So I think it brings us back to the question of, well, what is the goal we're trying to accomplish? We would like everyone to have a safe, comfortable place to live. Would taking over these particular functions advance that goal? And my feeling is, in the absence of other programs to increase access to affordable housing, the answer is no. And it might worsen the situation, which is a really unfortunate place to be in, because it's galling that people live in unsanitary and unsafe conditions in this day and age. And that the state, who is supposedly in charge of ensuring that that doesn't happen now, does not seem to be following through on that responsibility. So I just wanted to kind of come back to say I really appreciate seeing the financials.
Absolutely.
And yes, it's not a hugely financially viable thing without significant fee increases, but also, I mean, we're talking $5,000 in the hole, which in the grand scheme of things, right, if we decide this is a priority, that's not unreasonable. But coming back to that question of, does it actually advance the goal that we're trying to achieve? Perhaps with other things in place, yes. But in the absence of having other things in place, I don't know that taking on a new project like this is necessarily a good use of time and energy. Those are my thoughts.
And I would add that with the prospect of continuing cuts in grant support would perhaps already stretch an already stretched, additionally stretch an already stretched public health budget. And the other question that I came up with when I was looking at Jeff's second set of numbers, the orange numbers, is with those fees being doubled, one wonders whether the mobile home parks would simply choose not to pay, choose not to participate. Would we have to close them down because they were not paying fees? I mean, it's fraught in all kinds of ways that make me sad.
Yeah, I think that's definitely a possibility. And if we do increase fees, my expectation is the park owners are going to pass that along to the residents. They're not going to absorb that cost. So that's one concern I have, is if we raise fees too much to cover the program, is that just going to make it more expensive for the residents there? And you're right. Some may say we don't want to pay, and then we have to work with Corp Council, additional time and costs to go through that enforcement process.
Anyone else have questions or comments for Jeff? KT, anything further?
So the point of bringing this back to you is to get direction from the board and how you would like us to continue forward. If you do want us to spend more time on it, I'd like to hear that. But what I'm sensing from the room, not at this moment, but I'd like some explicit direction.
The chair probably shouldn't comment, but Supervisor Steen gets to comment.
Yeah, thank you.
Yeah, you're welcome.
Chairman, Ms. Chairman, Chairwoman. I think, person, yes. I guess, what does the county get out of this? For one thing, besides cost, and the PR end of it would be not very good, I don't think. And in the end result, I think we'd be incurring some other costs along with trying to enforce whatever rules we have. And so I would go along with a good doctor. It's a great idea, but at this time, I don't think it's viable. So from my point of view, I would say, no, I wouldn't spend any more time on it because it's not, in my estimation, it's good, but are we are we biting off more than we can chew? And are we going to deliver what we'd like to deliver? So that's how I would look at it. Thank you.
Thank you for that feedback. So we will continue to follow up on human health hazard complaints when we have complaints that come in about lack of potable water, lack of sewer, lack of heat, lack of electricity under our current human health hazard ordinance. And we will revisit this when and if the board directs us to. Thank you.
Dr. Hall?
So my question is if it would be possible to maybe collect data on those complaints that come in to get a sense of the scope of the problem that we might be dealing with. Of course, understanding that sometimes these things go unreported or underreported because there's all types of power dynamics at play. I think that would maybe be the only thing that I think would be useful moving forward. And personally, I would actually also be interested in seeing, like, for those human health hazard complaints, what are we looking at countywide, right? And where are the problems? And I don't know if there's already a spreadsheet, a roster.
Probably
There
not,
probably,
probably
I
not.
don't know if there's something already that tracks that. But if we're going to care about this issue of safe and appropriate housing, then some data would be useful.
And if you recall, the DSPS data is are absent. So
I would share that this is not an electronic record for us at this point. They are literally on non-carbon paper. So we can absolutely pull that together. And I think better so moving forward, we can make an intention, make a concerted effort to put that electronically and be able to pull that for you in 6 months to. Okay.
that would be fine. Anybody else have an opinion here about moving forward? All right, Jeff, thank you for the work that you put into these numbers, and thank you, KT, for bringing it back to us. It's a appropriate decision, I think, at this point to just pause consideration of adding this as a program.
Yeah,
So-
I think one other last comment I would have for Dr. Hall, your comment, is I think if we took on the program, the amount of complaints we would get would increase significantly. Once word gets out, oh, Dunn County's the new sheriff in town, you call them and they'll take care of it. You know, I think that might see an increase in some of those, but that's definitely some data we can look at to move forward.
Thank you.
Thank you, Jeff. Thank you again. All right, moving on. I think Paula is calling these bright spots. So we're introducing bright spots that will inform us about this enormously complicated set of programs and budget. Can I turn this over to you to introduce Jessica?
Sure. So there's a two-part to this bright spot. This morning, at our month, well, we have an every other month in person all staff meeting. And this morning, the economic support team presented a bright spot for the rest of the staff who were here. And the whole team was there to talk about all the good things going on in ES. And so Jessica gets to summarize that in a presentation tonight. Jessica Lindstrom is our manager of our economic support program. And so then after she's done with the bright spot, kind of all the fun stuff that's going on, then I will walk you through the infographic that you have in front of you. And what that is information that came on a Word document in the packet for you, but this is prettier. So we'll walk through this, okay? So
we love pretty.
Yeah, so I'm
Welcome,
gonna hand it
Jessica.
to Jessica.
Hello, thank you for having me tonight. Let me go ahead and share my screen.
And you had a 2-page document in the packet.
This month in economic support, we're shining a light on the meaningful work we get to do as economic support specialists, whether responding to calls through the call center, processing applications, determining program eligibility, managing benefits, reviewing ever-changing policies, or supporting one another through the ups and downs. Every facet of our work plays a critical part in serving our local communities. We help residents across 10 counties access vital programs like Food Share, the Wisconsin Shares Child Care Subsidy, and Medicaid, often during the most vulnerable times of their lives. We meet them where they're at, whether they're homeless, leaving incarceration, food insecure, facing job loss, receiving new medical diagnosis, growing old, or struggling to cover the basics with patience, professionalism, and compassion. We are called to remain steady through the change and to balance heart with hard decisions. The work is challenging, but we show up because we believe our efforts make a real difference in the lives of the individuals, families, and communities we reach. Here in Dunn County, this is who makes up our team. We have myself. I have 2 lead workers. I have 2 staff that are currently part of the child care team. Ashley and Misty are also part of the family team, which also includes 4 other staff. And then Misty is also part of the benefit recovery team as well, so our fraud department for the consortium. And then we have 4 staff on the elderly, blind, and disabled team. Currently, we serve 10 counties, including all of the counties listed here, which are in our Great Rivers Consortium, and we are number 1. We like to think that we're the best one, but yeah. So in 2024, the Great Rivers Consortium staff processed just over 44,000 new applications with a monthly average of just over 3,700. In Dunn County, a total of over $7 million in food share benefits were issued to residents in 2024. Most individuals served are the elderly, disabled, and children. And we asked this question in the staff meeting this morning. Raise your hand if any of your clients have benefited from any of the programs in the economic support program. We may not build the same relationships that other departments build with their clients because our work is different. The way we are built is different, and we may only have quick snapshots of time with the clients. We do provide resources that do enable the other departments to build relationships that do help elevate others, and we are there for the moments in the lives of our consumers rather than the journey. In economic support, the bright spots often are those smaller interactions that we have with the clients. It is a joy and a privilege to assist community members in times of need. It brightens our day when we receive the appreciation and gratitude from consumers receiving help. Sometimes we even receive gratitude from consumers who no longer need our services, as is highlighted in our first bright spot. So these are actual calls that my staff have received from call center, and it might have been a Dunn County resident or it might not have. It was one of the counties in our consortium. And these are actual quotes that were made during the call from the clients. So with this call, they called and wanted to share their good news. After nearly a year of waiting, they're finally receiving workers' comp and are now over the income limit for benefits. The member fully understood their coverage was ending, but took the time to call and express their deep gratitude. Though this member never ended up using our programs because their workers' comp came through just in time, they claimed that they never forgot how supported they felt during a very difficult time. They wanted us to know how thankful they are for the help they received and that it's a comfort just knowing these programs are here if they ever need them again. This member called to confirm that their benefits were ending, as they were now working and had exceeded the income limits. Despite the closure of their coverage, the member was understanding and made a point to express sincere gratitude for the care they received while enrolled. I think this message was a powerful reminder of the positive, lasting impact that access to health care can have. This individual in their 60s called in to apply for food share after the recent passing of their longtime partner. In the midst of their own grief, they had taken in their partner's 3 children, one of whom was currently facing additional personal challenges and were struggling to provide for the children both emotionally and financially. After receiving food share benefits, they were profoundly grateful. They shared that they had been considering asking their elderly parents for a loan just to feed the children, but thanks to the support they received, they would no longer need to do that. Their message was a powerful reminder of the impact that this work can have on families in moments of crisis. This individual called to discuss the food share work exemption. To receive benefits, recipients who are able-bodied adults without dependent are required to work or volunteer up to 80 hours or more per month. After becoming disabled and no longer able to work in their previous field, this individual qualified for an exemption from the work requirement. They have since taken on part-time work at a physical therapy center and are actively partnering with the Division of Vocational Rehabilitation to explore pathways back to full-time employment. Although currently exempt due to their disability, they asked how to remove the exemption. They were committed to updating their status as soon as they were able to meet the 80-hour threshold. Their motivation to regain independence and self-sufficiency was striking. They now receive healthcare and food share and expressed heartfelt gratitude, saying that they generally look forward to the day that they can share they no longer need this assistance. And finally, this client had been worried and anxious about whether verifications had been submitted on time, as they rely on their medical assistants for scheduled therapy and medical appointments. After a worker processed the documents and confirmed the case was updated with no gap in coverage, the caller felt an enormous sense of relief. They had shared how essential medical coverage is for continuing therapy and expressed deep gratitude for the support, recognizing the consistent helpfulness of everyone in the call center. As economic support specialists, we seek daily to live out our mission and our vision. Our mission is to provide the right benefits at the right time to the residents of our 10-county consortium. And our vision is envisioning a community where all individuals have equal opportunity and can meet their basic needs when they have limited financial resources. And I want to say thank you to all of you for inviting me here to present, to share a few examples of the bright spots that we get to live out with our clients. And thank you for working with us to create a more helpful outcome to those in our community. We appreciate you.
And we thank you for your work. All of you did nice bright spots. Probably we all needed them today. Dr. Hall.
I just want to say thank you. That was so thoughtfully put together, and the stories were really well chosen, and the background and the context you gave us. It was really powerful. So I just want to thank you for that.
Thank you.
All right, are we turning this back to you, Paula?
Yep. So, no, well, I'm not so Debbie Downer.
No.
Talking about-
She's the bright spot too.
Talking about the money part of it, so we have all the good things that are happening in the program, and then we have the money part, and it's really complicated, right? So we hear a lot of times, I just don't understand the human services budget. I can't even get it up on a PowerPoint today, so that's how complicated it is, right? So we wanted to do some deep dive for you, to be able to really understand the program and the expenses, revenues that come in with that. So the infographic you have in front of you, kind of outlines the program. So we spent 1.3 million, almost 1.4 million in 2024 on economic support service work. Majority of that is the staff, right? There's a little bit of like paper and pencils and computers and those things, but the money that takes to provide the service does not come from Dunn County, right? So it's Medicaid and Medicare and all of those types of things, food share. We don't pay any of that out in Dunn County. So this is really, oh no. Dan, I think I need a new computer. Because it just keeps going down. But you have the infographic. Oh, and it's still up there. All right, so 1.4 million. When we look at what we receive in grant funding from the state of Wisconsin, it is a little bit over 1 million. Now, we also put in county levy of almost $300,000 in that because there's a match with this program. So the state says, counties, you will do economic support and you will pay this amount of funding as part of this. And each county, they tell us what we will pay. And if for some reason we would say, we're not doing this anymore, they would say, okay, but you
Pay us.
pay 3 million or $300,000, right? So that's your share of contribution for this program. And so that's a given. There's no negotiation over that. That's just what it is. And so then we kind of drill down a little bit deeper into this and how all of this works. I should say the maintenance of effort is 363,800, but the county puts in 297,102. And some of that is we are able to drill in dollars from other areas that we can use as that match. So if you say that doesn't match up, that's because we're pulling it in from other areas that we can use that money to help with that contribution. So one of those pieces is AMSO, and that's fancy acronym for Agency Management Support and Overhead. And so that's the cost that goes into the program for things that you aren't directly paying for the program. So my time, some of Becky's time, the computers, all of those kinds of things, pens and pencils. And so we do that in our department based on FTE. So the number of staff in ES and the cost of each of them are divided out and those expenses. And so in 2026, the number for AMSO is 173,592. And then you have indirect costs. And those are the things that you really also do not see. So that is some of Dan, some of our CFO, it's the treasurer who pays the payroll, it's HR, it's all of those kinds of things, buildings and all of that. So that indirect cost is there. So that total is 423,394. The shared cost of that. So when you look at that amount in economic support up to July 1st of 2025, we could charge those costs to the federal government and get back 50%. Okay, so that's really nice amount of money that comes back that we're able to then use to help pay for some of the MOU costs and those other types of things. So in the end, what happens with what we can bill and bring in underneath that in the program, we actually have a net savings in this program of 490,000. So this program actually brings money into the county. Now, we are very fortunate in human services that the county does not take back the indirect because that's a cost that's coming out of the county budget, right? For the cost of all of those people that are, doing the work outside of our department. We're very fortunate we get to keep that money coming back into us. And so that does help our budget. So instead of saying, hey, can we have an additional $249,802, there is money's just not passing back and forth. Does that make sense? Okay, so having that happen, we're able to bring money in to the department, which is that 490.92, and that actually helps then other areas within our department that doesn't have the same amount of money coming in. Now, I mentioned July 1st, 2025 in the big, beautiful bill. It reduced the county ability to bill for MA from 50 to 25%. And so this looks different potentially for us this year. What we don't know is what the state will do with that. Right. So the
Right.
state hasn't said, oh, counties will backfill you or any of those kinds of things. We have no idea what that means because that's a huge hit for counties doing
Absolutely.
this work. So at this time, we are still sitting there in the budget with the projection of 50% being able to be billed back and drawn in. And if that changes because the state says, yep, it's on the county's back, we're not helping with that, we would then have to look at where does that other 25% come from? Does that make sense, Bill?
Is that anything? Oh, I'm sorry, Bill.
Yeah, so you mentioned you were not sure about what the state would do, so the state, some of this doesn't kick in this upcoming year, or does it, I guess?
This
Did the
one
state
starts
address this at all in
July
the new biennium?
First,
that
the
just-
state did not.
Okay.
No.
So
It
it
was
would
silent.
be 2 years before they would. if
We
they
don't
were-
know.
We don't,
We
yeah.
don't know if
you
there's
don't
some
know.
other money
Yeah.
they can move somewhere or
Okay.
those kinds of things. Sometimes there is some, it's been silent.
Okay.
We have not heard anything on it, so we're kind of sitting here waiting to know how that
And I
impacts.
was just about to ask you if the Wisconsin Counties Association has taken this on. If
I know
you-
they're aware
if
of
you know.
it. We've been talking about it with WICSA, which is the County Human Services and all of, and WCA, but I'm not sure where they're at in those processes yet.
Dr. Hall.
So my question is when the change in the federal reimbursement is going to happen. I know some of the things in that law took effect right away, some in a year, some in 2 years. Like when is that reduction from 50% to
July
25%?
1st, 2025.
So already did.
Last month.
Immediately it did.
Last month, yeah.
And you also said that at this point, your proposed budget for 2026 assumes that we'll still get that 50% charge back, or that's not the right word, but
Right.
so kind of assumes that the state is somehow going to find a pot of money to make good on that.
When we created the budget, which was way back when I started this, we didn't know that this was gonna take place yet, and so we kept it there. So we haven't changed anything in there.
Mhm.
And because it's been silent, and since that happened, we've just kind of sat there and said, okay, we're hoping that something happens here, but we have not adjusted it at all.
Okay, one last question is, can you give me a ballpark estimate of like right now, that money that comes back from the federal government that is 50% of our charges, how much is that now usually? And so
Sure. So the
what
Um,
size of a loss are we potentially looking at?
Sure, sure. So when you look at Amazon indirect, the total cost of that is 423,000. So we get 50% back of that. So instead of the 50, we would be getting 25% back. And then we also can bill back the grant that we have with the state. So those expenditures. And so there's money coming out of that 1 million as well. So combining that, it's a large amount.
Yeah,
It's a big
it's
hit.
a lot. Okay, thank you.
Mhm.
Anything else for Paula or Jessica?
And then on the back,
Oh, sorry. That's
I
right.
just wanted to share because I met with a couple county board supervisors and said, what would be helpful for you to understand in the finances? And one of the things I heard was that they thought it would be interesting to know like our programs compared to our neighbors. And so we put in here the 10 counties that are in the consortium. Some of them are not close neighbors, but because we're in this consortium, we did put that information in there so you can see Eau Claire is the lead county in the consortium. So they have 36 staff. So there's a lot that goes into that, right? Being a lead. And so there's many more things and they're larger than us, but we are pretty standard there with the ones that are our size. Working the program. And then remember that our staff, the lead county designates how many staff we can have, and then the reimbursement for that. The reimbursement comes in a big pool to the lead county, and then we're paid out for that. So even if we have one staff more here because another staff wasn't able to hire it, we get reimbursement for that. So there's that piece of that as well. So that's data for you. Helpful, not helpful, do you think?
Helpful.
Yeah, this is good? Okay, good.
Good.
So next month, ADRC.
Okay. All right. Thank you both very much. You can. All right. We're moving on to Veteran Services. Greg, you are up.
All right, good evening, everyone. To start presentation off for the month of July, I know locally I'd identify there's nothing significant to report for the month of July locally. However, that's wrong. It's correct for July, but wrong because this Saturday, if you are hungry, Moose Lodge is putting on a fundraiser, serve chicken. I will be there dishing up plates and following all the direction that is given to me by the folks at the Moose Lodge. And I'll have 2 VIPs that'll be there with me. Two grandsons are going to show up.
Oh, awesome.
They're not going to be any help though. So yeah, if you're hungry for some chicken, show up 5 to 7. Be great to see you there. The Moose Lodge is always great about. It's been probably 3-4 years now that they've offered this up. Item number 2 in the state level, I participated on the Wisconsin Department of Veterans Affairs Interagency Council Mental Health, their listening session. My contribution is kind of twofold. That also the state's association's president, and then kind of representing our area on the as far as association. Really the homelessness in regards to veterans, as well as mental health and suicide, really all run parallel. And working on one can positively impact the other. So I just wanted to stress that with them. And then I hit them up a little bit on our local, my assessment that we will be seeing some local strain due to the closing of the Veterans Housing and Recovery Program over in Chippewa Falls. In the anticipation, at least in talking with my cohorts, really anticipating some of that local strain on resources will happen as the fall starts, because sometimes within that homeless population and culture, pretty resilient with when there is decent weather. But I think that request for some of those additional resources locally, because not everyone is going to want to uproot and head to different part of the state when some of their support systems are here locally. So we're being mindful of that, and we certainly want to be there to support. And I'll plug the Veterans Administration's Housing and Urban Development. Their homeless, basically their homeless program with their vouchers, which are basically their Section 8 housing choice vouchers that are just directed for veterans. I had spoke with representative from Representative Van Orden's office, his veterans kind of liaison, and just emphasized that it would be great in lieu of the fact that the homeless shelter is closing, that they try to request and plus up some of those HUD BASH vouchers, because that would just be a natural local response. And so just to kind of plug that out there, because it's a great program. They have social workers assigned, and it is a true housing first model, which is get people housed, and then hopefully you can start working on those resources for if there are some chemical dependency challenges. Well, and it is effective, and they do a great job. The next thing, I was invited to participate in advisory group for the Veterans Memorial down at Camp Randall. They're doing some updates, so certainly took advantage of that opportunity, and that's part of being as the president of our association. So they asked to represent. I'm like, all right, that'd be great to be part of that. And it's really they're so tasteful, and they're working with the designers and the engineers, and so the advisory role is pretty limited, to be honest, because they have such a great they have great ideas, and they have the Veterans Museum right down in Madison. So they're really looking at doing some wonderful things. So I'll keep you posted on that as well. On the federal level, you last month, coworker Jessica Christensen gave the report for our office, and it's good to see the staff, because oftentimes we get to be the face and get credit for the great work that they do, and so it's good to see them in person. In supporting individuals' education and advancement, and just their search for additional knowledge, there was an opportunity that we took advantage of, and she was selected out of 40 candidates to be able to attend an additional representative training skill level. She's been doing this long enough, and so she definitely has the high skill level, but this creates an opportunity to go and see how another organization trains, and to be able to hopefully bring information back to share and teach within our office. No cost to the county other than staff time, which I think any type of development and training opportunity that's free all the way down to the per
Absolutely.
diem. Want to definitely take that. And there, yeah, she was only one of 10, so that's a huge credit to her skills and stuff. So interested in reporting back. Looking forward to doing that on how that training went. And then just on the with some of the changes that are proposed with the current administration, just keeping everyone advised on up to date on what's going down. So it looks like last report kind of looking at scaling down some of the reduction in force and just using natural attrition, deferred resignations, and again, naturally when you're overseeing or leading anything, you see the reduction in staff and the capacity. You would automatically think that's going to be a reduction in quality, reduction in productivity. Those are things we're observing with our direct contact within all three of the Veterans Administration programs, the VHA, which is Veterans Housing Administration, VBA, which is the Veterans Benefits Administration, and then the Cemetery and Burial. And I know I've reported before. The one standard is just inconsistency. We haven't really seen in any lengthier delays. It's just inconsistent. Everything is pretty much static from my years of service doing this, the 14 years. So I would anticipate things to continue, and I'm more optimistic that things will kind of just stay static as we go forward with processing of claims. Bigger concern is just our local healthcare footprint with the VA to take care of our folks, and the staff within the VHA. Quality is outstanding, customer service is outstanding, but there is this there's some uncertainty surrounding the expansion of community care, outsourcing a lot of the services for healthcare, which could positively impact some of our local providers, but it's just kind of uncertain. But the staff at the VA is operating great, upbeat, and veterans are reporting that things our service are still going well. You never can get in to see anybody fast enough anyway, so that I think that's going to remain the same. But everybody so far up to this point haven't seen anything that I would view as really negative at all. I think things are going okay. On the financial side, just I'll speak directly between the 2025, give a little bit update on the 2026 budget here after I talk about impact statement and some of our workload. Provided a comparable from the 2024, our outputs to just reference that against the 2025. I'll dive into the two impact statements that I provided. The first one is we don't encounter very many of our veterans that actually fought in Grenada. It's kind of a historically significant thing. So I really enjoyed my time assisting this veteran. And interestingly enough, anybody that's ever been around a paratrooper, the infantryman that love to jump out of stuff, like it was some of the things that significant to him is their mission was to take the airfield. That's what that 82nd Airborne Division, one of their specialties. And another group, there was another company, I think of Rangers, they actually beat him to it. So he was upset that they didn't get jumped, so they had to land. It was just kind of interesting hearing those. You're like, I'm like, that sounds unsafe no matter what way you look at it. But there had been a number of things, highly articulate individual, been receiving long-term therapy and care, lots of markers throughout his whole life, super humble, and just through kind of working with him and approaching some things with the Veterans Administration, I was allowed to sit in because he was very reluctant to go trust and things. We were able to use our office and do a virtual examination with a licensed professional counselor. And I couldn't say anything, but I just sat in there, and it was very interesting to just be able to view and see that, and just the care that examiner took, because they're all contract. but the examiner, the veteran and I had been through 3 different processes to try to get things approved. And this examiner's like, I don't even know why you guys are here. This should have been done a long time ago. And it was very, very encouraging. And the biggest thing for this veteran was it validated his experiences and validated that somebody really took heart to exactly everything that he had said. And plus, he had earned combat awards that really were indisputable with this. But sometimes the process, it takes somebody sitting to the left or the right to walk you through, just to stay strong through that process, to then have that positive outcome. And I'm glad that he stuck with me. Trust's a tough thing. But it was good for me educationally to see and experience that, how that went inside that room. The next one again is a long process. This particular veteran, grenade simulator exploded next to his head. And again, the markers are all service treatment record from vertigo, nausea, 10 days off of duty. But this was quite some time ago. Before we started, there's more knowledge and more information out about traumatic brain injury, where often we just called it a concussion or got your bell rung. Sure. But that had created a lot of issues throughout his whole life. There's just a continuity of symptoms and treatment for vertigo, and anyway, through a long process. And the other outside thing with this, when you have multiple head injuries, you really run a higher chance of additional issues, mental health, from depression to anxiety and stuff, and then self-medicating. So you can about imagine all of those additional things that were going on and the impact on the family, and 5-6 DWIs, 5-6 times through treatment. And the Minneapolis VA's trauma clinic is just an outstanding group of professionals. And that's usually anytime there's head trauma, I'll try to encourage individuals to seek some treatment, if nothing else, to get the baseline on where their head injury, their traumatic brain injury is at, so that they can then observe any changes in the future. And they do MRI, it's incredible. But just that visit and working with that staff gave us what we needed to get everything validated, protection for the staff. And this is just a hard-working individual, that contractor, and you struggle when you have vertigo and you're on top of buildings. And so this is going to help their family out. And again, another situation, glad he stuck with it, and the family, encouraging, because it's tough stuff to deal with. Any questions about any of the stuff that I went over?
Questions about impact numbers?
And I'll move on to the budget then. Quickly, with the 2025 budget, I think I say this every month. We have three cost centers. First cost centers to just our over operational costs, and then we have a soldiers and sailors relief, that is our financial relief cost center, and then we have a grant from the Wisconsin Department of Veterans Affairs. For our 2025 budget, up to this point of the year, there's I can't express any concerns at this point with that budget. I'll just quickly go over the 2026 and just a couple differences just for you. If you're doing a comparison with those budgets and any of those changes, the first thing that I would point out is it gives an appearance of a decrease in our budget from, or I'm sorry, a decrease from 2025 budget to 2026 budget. If you peel that back and look at why would that be, I'll give you a couple of the reasons why there's a change. In 2025, we did a carry forward of $8,914 of donations. So that's going to impact, show that carry forward, increase that budget. We also identify how we're going to spend that. And then also an adjustment that we did for $2,063, which was an increase in the Wisconsin Department of Veterans Affairs grant, which that grant is reflected with that higher increase in the 2026 budget. So in reality, it's the true numbers are about a $4,000 increase in the 2026 budget if you back out that donation, because we don't know until the end of the year if we're going to have carry forward for those donations. There are, if you look at the explanations, I try to put that in there of some of the areas. Majority of our stuff is static, certainly within the operations, except a few small line items, but we're getting down into, I'm asking for a $70 increase in a couple. We have some flags that we purchase and sell to the public increase there, but overall, we're looking at a very minimal increase, and that's for our operations. The other areas are more going to be impacted by the decision by the county board in how with those numbers and how we go about that with the staff costs. And we're maintaining the same staff, little bit over 2.5 staff. Any questions about that, and just kind of looking at those two?
Any questions about the 2026 proposed budget? No?
That's all I have. See you for some chicken.
See you for some chicken. What are the hours again?
5 to 7.
5 to 7. All right. All right. Thanks very much.
Thanks.
As usual, a very good report. All right. We're moving on to the Department of Health. I will turn this over to KT. We have lots of stuff.
You do have lots of stuff. And so I'm going to keep it really brief on the update that's in your packet. I do want to give some background around measles. So as you have seen from the 2 press releases that Wisconsin DHS has put out, that we do have a known positive and then 8 exposed and symptomatic folks in Oconto County. And then we have a person that was, we believe, coming from another state that was part of an investigation that tested positive, and while in their symptomatic and contagious period, did stop at the Flying J in Hammond and made it down to, I can't remember what the facility was in Beloit. So looking at a 2-hour window of potential exposure for folks, making sure that if they were exposed and are unvaccinated, that they are watching for those symptoms and that they quarantine and call their provider before they show up, because we don't want to have an additional exposure. I will share that our Plain community providers, meaning the doctors that work with our Amish and Mennonite community within the Chippewa Valley, are deeply concerned. And they believe that we have additional exposures and additional cases that are not necessarily being reported for the same reasons that you saw in Texas. So we are working with our Mennonite school, as well as our other schools here in Dunn County that have very low immunization rates, to make sure that the school nurses and the administration know what they have available to them and how we can support them. But again, we don't know until we know. And right now we have 1 confirmed Wisconsin case. The other thing that I wanted to lift up for you, because you will see it come back, is, 2 things. Budgets. We are starting to see the reduction in federal budgets come through and hit our local budget, just as DHS is as well. So Fit Families was discontinued effective July 1st as well. And so that is part of the SNAP Ed. And that is a challenge for us. And then the other last thing I promise is really about our licensure and license fees. And so as you heard with Department of Agriculture, Trade and Consumer Protection, or DATCAP, the hotel and lodging code did go through, and there are additional breakdowns. And so we are going to have to bring that, not only the fee structure to you, but potentially the reg as well, so that you know that we will have an increased reimbursement to DATCAP, and we will have additional license categories that we don't currently have. Any questions about that?
Any questions for?
It is a huge increase.
Yeah, it's a big increase.
Yes. It does. All right. And then, other things from the packet, just some things for your awareness. Sorry. All right. With that, I think we're going to turn it over to Amy. Amy is one of our environmental health specialists. She is the driving force behind our water lab and it was really did an amazing job getting that up off the ground and being certified through DATCAP to provide that service to our community members in a way that is both cost effective and saves us some money so we don't have to outsource that. And so you had asked for information on the program. It has been up and running for substantively 8 months. Yep. But more like 6, just in the reality of things. And so in what I sent out, you have a beautiful comparison. And so I'm going to pull that up on the screen and ask Amy to talk through that a little bit.
Excellent. Welcome, Amy. Thank you.
Thank you for having me. Excited to be here to talk about the money numbers, as I've been calling them so casually. So in the packet, I just wanted to point out a few numbers that I thought were impactful. So in the packet, I know I put a lot of things in there, but I just wanted to be really thorough. The first 2 pages in this packet talk through or show the numbers for private wells. So those are people that have a home with a well, and the TN program. So the TN program is our transient non-community program. Those are our rural churches, bars, campgrounds that have a well that we as a health department sample and test for bacteria and nitrate every year. So the numbers on this first page are really our projected costs. So if this looks familiar, it's because you might have seen it before. This is what we use to base our fees on back in December 2024. I did a quick peek at some of them. I didn't redo all of these, but a lot of the costs stayed the same. So these numbers showing that it's about $20 to run a CoLalert test and $23.20 for a CoLaSure test are about accurate still. And we are charging $25 per bacteria test. So bacteria will result coliform bacteria and E. coli. So those are the 2 bacteria tests that we run in the lab here. The second page is the nitrate testing that we do for private wells and the TN program as well. I want to call out that this specific table is based on 65 tests. We had projected with our nitrate sampling and testing for this year in 2025 about 200 tests. So we based all of our testing on 200. So our projected cost per sample, that the lab expense itself would be about $27.79 per sample, and we're charging $30. So, we were getting a little bit of profit per test. As of right now, we've had about 65 tests come in from our private wells and TNs. So again, those TNs are the private churches, campgrounds, and stuff like that. A little quick note, we haven't sampled all of our TN systems yet, so there are more coming. And we've already, those TN systems do pay up front, so we already have that income in. We just haven't completed the sampling yet, so it doesn't exist on this table. The takeaway here is that right now with the 65 total tests, we're seeing a cost to the lab of about $31.37, and we are charging $30, so that is a slight deficit per sample. For just comparison's sake, we do base all of these numbers on running a batch. So each run of samples, every time I process nitrate samples, I want to do about 5 at once to make it cost effective. So if I were to, for example, run 1 sample at once, so just 1 at a time, it would cost about $35 per test. So all of these projected numbers that I had in December 2024 were based on batch running about 5. So right now, if we were to assume the same thing, 5 tests per run, it's at $31.37.
Jump to the punchline. What's the good news, Aiden?
The good news is we had a lovely collaboration with the Land and Water Conservation Department up on the second floor of our building here with Heather Wood. And with her project, she had grant money available and was doing, this is the third year, I believe, of providing free samples to Dunn County residents with private wells, which is really exciting. So thankfully, she used our lab this year. So she brought in, and at the time of this table, 300 samples, but in total it was 311 samples that we processed in our little lab over the course of 6 weeks. And was it a lot? Yes. It was a lot. But I feel like I've got it down to a science now for running these samples. So with the Land and Water Project, which was a huge project for us, it ended up being each sample for nitrate was $19.90 per sample, which is a huge difference than if
Yeah.
you're running one of $35 per sample to $19.90. So we're making about $10 per sample for running nitrate with the Land and Water Project. Yay us. So on the next page there, I did want to kind of show what this all means together. Essentially, in that top table there, if we weren't running batch sampling, we would be in the hole about $411, which is kind of a hard pill to swallow, right? But with the Land and Water samples and batch running, our net profit was $3,000, which is huge. And so the average cost of the nitrate samples for the total of 365 samples so far, the average cost is $21, so about $22 per sample. So again, we're charging $30, and then the average cost is $22. Yay.
That project.
Yes. So such good news. So Land and Water does continue. They have more money available. So next year for sure they will be using our lab as well, which is a huge benefit. So I guess what I'm trying to say is based on our projected profits. So on the last table there, at the left-hand side, I have in yellow what we projected for Cholert, Colisher, and nitrate. So Cholert and Colisher are two bacteria media that we have for bacteria analysis, and then our nitrate. So we projected 400 total samples for a net profit of $1,000. This year in the orange, we actually, of course, we had less Cholert and Colisher so far in the 8 months that I've had data. We still have more time. We have less samples for bacteria as a whole, but that nitrate really did help push us through at the batch sampling rate. We were really able to get over $3,000 of profit as a whole for our water lab, which is great. Yeah. So I guess the main message here is that the water lab was successful and profitable so far in this first 8 months of use, which is really exciting. We totally right now counted very roughly. We have over 500 samples total that we've processed and 8 months in for this year. So we're doing really well there. There are a few opportunities that we have for the water lab. I would like to see more private samples come in from private well owners. So we do want to increase our advertising and make sure people know that we're here. There are a lot of great labs in the area, but we're really close by. So come by and use us. We also have a couple other options too for implementing a billing option and an invoicing option. So we can reach out to our other water systems that are regulated by the DNR. So those are your OTMs, which are other than municipal systems. Those are your rural mobile home parks and apartments that are on a well, not on a public water system, or NN systems, which are non-transient, non-community water systems. And those ones are your rural workplaces. So the non-transient aspect is the same people every day drink the water. So think of like your cheese factories and I don't know other.
That's a great example.
Thanks. I went past the Old Galley Cheese Factory the other day, and I was like, oh, that's a good example. Yeah, that's an NN. So right now, Jeff and Abby and the EH team are both working towards creating like a billing invoicing process for us to use. And the reason that's important is because the people that bring in the water samples for the DNR requirements are oftentimes not the well owner. So the person that's bringing the sample doesn't necessarily have a company credit card to put down and pay for the sample as it comes in. So the ability to bill them is really huge. And the other opportunity I have that we already talked to is that the land and water folks will be using our lab next year again for the same, hopefully the same amount of samples, like 300, and we'll be able to batch sample those as well. And we also, I should say we, it was Jeff, applied for the Environmental Public Health Tracking Grant recently. I believe we find out at the end of the month if we were able to get that money. I believe it's $10,000 to hopefully support the land and water project as well, maybe a shared intern,
That'd be great.
maybe covering some lab fees and costs of the sampling and whatnot. But overall, really good news. So does anyone have any questions?
Anybody have any questions for Amy? I will say I'm on the Planning Resources and Development Committee, and Chase Cummings reported on this yesterday and said this was a very wonderful partnership between the two departments. And so our compliments.
And I did want to just like lift up, when we call this a profit, it isn't really a profit. What it is doing is it is paying for the costs that we have with the lab. So you know, when we buy those, the media and the tests, there's a cost to that. If there was to be depreciated value in our incubators or in the equipment we use to run, then we have the ability to then pay for it. And so, but I'm always excited to see when a program is paying for itself within the first year. That's amazing. So I just wanted to lift up that good work that Amy and the EH team have done.
Yeah, thank you very much.
All right. So without any other additional questions, let's talk about money.
Money, money, money.
All right. So you have our year to date and our budget ask for 2026. And so two things I did print off, but it's also in the team site, a list of our 13 programs in the health department and 2 shared programs. It is teeny tiny, but you can make it bigger in the team, as well as the larger sheet that I printed out for you. What you're looking at is a list of our programs. You see the money associated with those programs. So we have the cost, that's the people and the stuff. You see the FTE, that's a pretty good estimate because you know that we do 100% time tracking. So we're able to really slice and dice people where they go. And then the non-personnel cost, and then any revenue that comes in. So you guys can go through and see that most of our programs have a small amount of revenue. However, most of them come nowhere close to covering recouping costs. So especially those unfunded mandates around communicable disease follow-up, immunizations, human health hazards, you can really see that we have 1.5, 1.3, 2.1 FTE, and it brings in something like $6,000. So wanted to lift that up. You also have on that same grid, if it's mandated or not. And so I'm really judicious in what I call mandated. We are required by DHS Administrative Statute 140 to have certain base level programs, and they really surround some of our work with our CHIP-CHA, some of our work around our emergency preparedness. We have to respond to emergencies. Some of our work around human health hazards, and some of our work around disease control. And so those are solidly mandated. When we get into level 2 and level 3, you are not required to have a level 2 or a level 3 health department. We are a level 3 health department. That's when we're seeing other things that are partially mandated. And so you're seeing maternal child health work, you're seeing public health and nursing work, you're seeing environmental health work. And so those are either partially mandated or there's some explanation around that in that column. And then finally, we have some not mandated work. So we have had a reproductive health clinic in Dunn County for almost 30 years. We are not required to do that work, but we continue to see a gap, and we continue to see data around unintended pregnancies. And so we work with and increased STI rates, both and. We work within the community to meet people where they're at and make sure that they have access to those services. And then our delegated programs, so DATCAP, DSPS, DNR, we have contracts with them. We recoup cost-ish in most of them. And that's one of those ways we can afford to do the work for human health hazards, and that those are the same staff members doing that work. So as you're thinking about the budget workshop next week, please have this in the back of your head about what the health department does, what the costs are, where we're recouping costs, and what we're required to do and not do. Any questions on that?
Any questions on the priority checklist?
Okay. You also in the packet have a very preliminary budget, as you've seen. Right now, we are showing a shortfall of about $130,000. That will change, very much so. We are continuing to assume that we have flat funding from our federal pass-through dollars, even though they are at risk. Right now in the budget, we know that we have a reduction in our emergency preparedness by about 30%. We have a reduction in obviously the SNAP Ed portion of WIC. We have a reduction in our reproductive health also to the tune of about 30%. And we are waiting to see what else is impacted. This will change as we get better grant numbers. This will change as we get better personnel numbers because, like Paula said, the majority of our costs are people. Any questions on that?
Any question, Dr. Hall?
Yeah, so I had a question looking, just kind of looking down through the document and looking at changes to salaries and wages. And the question that I have is that, the comment will be, includes the 2.75% for meeting expectations, and yet the total increase over this year is 14% or 18%. So are we increasing FTEs or increasing hours? So I was curious about what was driving that.
So we're not actually increasing FTEs. So that is the cost for folks to have that meets expectation. But also the other bits, the fringe that go into those individuals. Right now, we're actually holding on filling a couple positions, and we have reduced some hours because we're anticipating cuts.
Yes, Supervisor Steen.
Are you anticipating any efforts to claw back money that you've already got?
That's a great question. So you guys will all remember that the public health ARPA dollars were clawed back to the tune of, I think we had like $218,000 that went back to the feds here locally. We have not spent anything that is being litigated that was meant to go back, with one exception. We had some COVID era dollars around immunization. And of course, the state has litigated this. They say that we are free to spend it. We feel a little more cautious because it's a lot harder to give back money we don't have than money that we haven't touched. But one notable exception is we needed EpiPens, and they are stupid expensive. And so we went ahead and spent COVID dollars towards purchasing that for our clinics currently. If we would have to spend it anyway, but if we can get COVID dollars to pay for it, then we are.
Yes, Supervisor Steen.
An additional question for you and Paula. When would, as we go through the budgeting process here, when would you, it appears that it could be pretty fluid. So when we got to decide in November, let me put it this way. I assume that we'll be getting some different figures as we move forward.
Mhm.
Okay,
I anticipate the same.
yeah, thank you.
And I do want these three budgets to come back to the committee as we have a little more information.
Absolutely. Okay, and then we had this year-to-date budget also there. Oh, I don't have that up. And so that shows very, I would say, preliminary data. We had some really good unexpected revenue from the water lab as well as from our reproductive health clinic. And so we are showing a 50,000, give or take, to the good. I do not anticipate that holding. And it's also reflective of, we had 3 new babies in the division. And so many of our new families took unpaid time off. So our salary is a little bit lower. And like I said, we have reduced some hours within the departments, both by not filling a position in WIC and also reducing days of the weeks worked by one of our admin professionals. So we're just trying to mine that budget very closely. Any questions on year to date?
Any questions on the year-to-date budget? Okay. That's it for KT? Yay, you are off the hook. Thank you all. And now we're moving back to Paula and DHS.
Yes. So I have a director's report in your packet. It's getting late, so unless you have questions, you can review that. Okay, nobody's gonna argue with me over that, huh? All right. So going to the 2025 fiscal report, we are projecting right now at $415,234 to the good. But I did want to let you know that last time I talked about the person that was in Lincoln Hills, Mendota, same type, but those costs, and I think we were talking about that about being about $500,000 a year. He did come back to the community, although there's a lot of support services that are being put into place and some detention costs and stuff because it's not going as well as we would like it to go. So there's some of those kinds of things occurring. So hopefully though, yeah, we'll just fingers crossed on that. But I was informed yesterday that we will have another new placement and signed a contract for a younger child that has extreme needs. And so I signed a placement contract for $474,000 for the year. $1,300 a day for the rate. So that is a new placement and I can't see that ending anytime. I mean, we have tried, if you want to talk about the amount of work that the social worker has done to try to keep this child in the home, it's unbelievably amazing, the dedication and commitment. And we could not keep providers anymore because they were being assaulted left and right. And so it just comes to a time where you have to make another decision.
Yeah.
And so $1,300 a day will be the cost of this placement and not short term. So when I tell you there's 415,000 projected, that does not include that cost. And obviously, you know, we don't have a, this is, that 474 is a year cost. So obviously we don't have that much time left in the year, right? But when we look at it long term, I mean, I can imagine it being there. So, yeah, with the remaining portion of the year at that rate. Other than that, I don't have anything on the monthly update unless you have questions.
Any questions for Paula? Yes, Supervisor Bosch.
So that 1,300, is that the new rate from the state biennium that the governor had?
This child will not be, this child is not old enough to be in an institutional, this is like a highly extensive home, like residential facility, but it's not the same because they're not anywhere close to being that age. This isn't a delinquent, this is a child with extremely high needs. Yeah. Yeah. Any other questions on that? Okay. So in your package, you had the two things. The one was the budget I tried to bring up Previously and not very successfully, my computer's crashed like 3 times since I've been here, so I'm not gonna try to bring anything up again, because I think that will just make
You
it
have
happen
it.
again. But you have it in your packets. In addition, there is the spreadsheet that came out on Monday, which is the priority-based budgeting spreadsheet that looked just like KT's, but with different cost centers and all of the definitions in it, the FTEs, the expenses, the revenues, what we are mandated to do. And again, like KT described, there's very few programs that are fully mandated. The couple that are fully mandated would be adult protection. The statute outlines exactly what has to be done there. Any kind of mental health placements, and then birth to 3. We also are responsible for doing things like child protection and the placements and the youth justice placements and all of those kinds of things. But there's like wiggle room in like what types of services do you want to put in place to help try to prevent children being placed, or institutional care and those kinds of things. And so the statute's pretty broad in some of those things. For example, our mental health clinic is not mandated, but you'll see, in the narrative that I put in underneath each one of those areas, the reason why we do it, even if it's not mandated, right? So hopefully that prevents our cost for emergency detention and hospitalizations, and cost reducing law enforcement's time to drive across the state to Mendota and Winnebago and all of those types of things, EMTs and all of that. So you'll see like the summary there, what's mandated, what's partially mandated, and then the impact on the community and the number of people served and et cetera. So that is all part of the priority-based budgeting worksheet that you have there in front of you. I don't know if you have any questions on any of that.
Any questions on the priority-based budgeting spreadsheet? I did sort of count of the 35 programs that you've identified here. 17 of them have either a full or a partial mandate, and others are contractually obligated. There are some of those lovely services that even if we chose not to provide them, we would have to reimburse significant amounts of money to the state. So it's worth keeping that in mind.
And then when you look at this, when you say like, why is human services so complicated in the budgets? Like, these are combined. There's many different cost centers and
absolutely.
grants in each of these. So when you think about that, like, this is just like a little mini version of what our budget is. So just so you're aware of that. Yeah. You are. I know you see the big budget, but it is worth.
Well, it is,
mentioning.
but thank you for saying that, because it is complicated. It's a lot. And hopefully we are the most well-informed about this, so.
Yeah, and as you said, we'll bring them back as changes continue.
I
And
want
as you
us
can
to
see,
come
they're
back.
hot off the press. On a regular
Obviously-
bus.
Obviously, I didn't want anything approved tonight because there's nothing really to approve.
Yeah.
So,
All right, thank you.
all right, that's it? Yeah, no, I know, but for Paula. I haven't lost my mind completely yet. Can we vote on it? Yeah, absolutely. Later. Okay, first item is the voucher report from DHS. Again, you had many hundreds of pages in your packet. Anybody need any clarification on this, our checkbook? All right, I would entertain a motion to note review. Mr. Lamb, thank you. Is there a second? She was first. Supervisor Bashan beat you. All right. She did second it.
Oh, you said she was first.
Oh.
It's a dad joke.
Okay. All right. The amount last month was $296, $296,363.44. I love the way we keep track of every penny. Any additional discussion? If not, I will call the question. All in favor of noting review? Aye. Any opposed? Vouchers are noted. We have two budget adjustments. One is a sort of comprehensive budget adjustment. KT, do you want to provide any context?
Yes, thank you. So let me pull that up real quick. Friend. Oh, for fart's sake.
Again, you have it in your packets.
You do. So what I really want to point out is that this is something that came to you before for that letter of support. And what it's doing is bringing $100,000 into Dunn County to support evidence-based harm reduction strategies for substance abuse disorder. So really forward thinking. And it is the strength of our criminal justice collaborative division and human services that we're doing a lot of this work that this funder is looking to provide matching funds. And so that's what else you're seeing in this budget adjustment, not just the dollars for CJCC, Health Department and Human Services, but you're also seeing a required match. And so that's our opioid settlement dollars.
Mhm.
If you do the math, you will see that it's not 100,000 and 100,000. And that is because in 2025, you've already approved within my budget within, well, actually what's matched is from within my budget, funding for overdose fatality review, OFRT, and for our harm reduction kiosk. So the money that you've already approved with opioid dollars to stock the kiosk out front is now going to be used to match with a gravity-fed Narcan dispensing kiosk in the jail, which is, I'm sorry, within the judicial building foyer, which is open 24 hours and definitely a need that we've been trying to fill. So that I think is important because this is a little unique in how it's being presented to you.
Mhm.
One last thing, we were able to use before the money was clawed back, COVID era immunization dollars to buy a new vaccination refrigerator. The old one was paid for, was sold on auction, and that $2,000 actually came back to us. Hooray! And so we're gonna do something fun with it, like branded clothing, so that when people are out in the community,
Yeah.
community outreach, they know that they're with the health department. So just I didn't want to like slip that $2,000 in there, but I kind of did. So any questions on that budget adjustment?
Any questions? All right, that's all the clarification we need. All right, I need a motion to approve of the budget.
I
Dr.
move.
Hall wins. Supervisor Steen seconds. Any further discussion? No? Are we ready to call the, yes, okay, go, Dr. Hall.
No, I don't have further discussion.
Oh, I'm sorry, your microphone was on.
I'm getting ready to say aye.
Okay, no clarification needed. I'll call the question. All those in favor of this budget adjustment signify by saying aye.
Aye.
Any opposed? All right. That passes, and we have another budget adjustment from Human Services. Some clarification, Paula? It's probably not on your computer. Do you want me to hand you this?
That home delivered meals, looks like we received an additional $396 for home delivered meals.
I know, right? I love these budget adjustments. $17.
Yeah. Yeah, gotta put
The
it in
first-
there.
First time my budget adjustment has been bigger than your budget
I know,
adjustment.
I know, I know. And then Bertha 3, looks like we got an extra $2,000, and I think that we got, I put that in my report. We received money from the community.
Women's Giving
yeah,
Circle.
Women's Giving Circle, thank you. So that's the budget adjustment in there, those
Yeah.
two things.
Any additional clarification?
Thanks for
All
the
right.
document.
You're very welcome. I need a motion to approve. Supervisor Bashan, Mr. Lamb seconds. Any further discussion? All in favor, say aye. Aye. Any opposed? Budget adjustment for the Department of Human Services passes. And, yes, Supervisor Steen.
Before we adjourn, I just want to say that I'm very proud to be part of this committee and the departments that we oversee and the great work that they do for all the residents of Dunn County, whether the public realizes it or not. And I'm very proud to be associated with you. Thank you.
Thank you. That's very nice. I think we probably all agree. And just for fun, we oversee $19 million worth of program. That's a lot. So thank you all very much, our staff and the members of the committee for your work. And unless anybody has anything else, we are adjourned.